psychiatrists rapping about our lives and work.
This podcast is not intended to be medical advice. Any stories we use have been altered to protect identities and sensitive information.
This is intended for entertainment purposes only.
You know it!
Ow!
Welcome to the Good Shrinks podcast.
Hey, how are you doing today?
Good. How are you, T?
I'm good. We're glad you're with us today.
We're glad. All million followers. We're very happy.
1 million, y'all.
It will be after this episode. You know why? Because we are talking about something that is a hot topic in the culture.
Affects a lot of people.
Gun violence and mental illness.
Wow.
It's a big thing, right?
That is huge.
And we do want to sort of preface, because we work in an emergency department setting, like gun violence isn't necessarily our forte.
Right.
But this is just, I think, an interesting topic. We can just try and chime in on the best we can. And it is something that's a sensitive topic, so if something that's, sensitive to you, just be aware.
Yeah.
So we kind of looked at mass shootings in the United States, and in 2023, they've really kind of escalated over the past 4 years. 709 individuals were killed in 2023 from gun violence.
That's not even just shot. I mean, those are people that died.
Yes. I have that number as well.
Yes.
2,676 people were shot in gun violence due to mass shootings in 2023.
What is that?
Like, why?
Why do we have guns just laying around for people to get and shoot each other with? Do you remember it? Now, you probably don't remember this because you're a baby. But when I went to elementary school, there were clowns, there were people that were bullies, but you solved that stuff with your words or fists.
Yes.
There was no weapons involved.
No. And that's actually something that even recently I traveled to Europe, and they bring it up. They're like, oh, you're from America. The first thing they say is guns. And they say that over there, if you have conflict, you can get into a fist fight with someone and resolve it. Not saying it's healthy coping, but it's something that is an option, where I feel like in America, we're almost more repressed because if you have anger towards someone, you're at risk of getting shot.
Yeah.
So there's even less ability to express your anger.
Good point.
And that's part of, I think, the mentality with mass shooters is they have a lot of this underlying anger.
Grievance.
Grievance.
There's something that has happened that has offended them, and the only remedy is to eradicate that person or threat
or
from the earth.
And that's often the case, and so, there's like this indoctrination online too of like they feel like they've been wronged. They feel like they're in more of a powerless situation, and it's usually very young males that engage in that behavior. And that ties into, like, is there a mental health component? And there's a lot of studies that were looked into, and there is a little bit of varying opinion on that. In a joint consensus of 60 mental health organizations in June of 2022. And this included the APA, and they found that...
That's the American Psychiatric Association.
Yes. They're overpriced, but we pay for it every year.
You said that, not me.
Don't come for me. But they found that 80% of mass shootings were not a direct result of mental illness.
Look at that.
80%.
80%.
But there's lesser, not I want to say lesser, there's a smaller study that there's actually two psychiatrists. Their names were Dr. Corfolio and Dr. Glick. They published an article that's often cited by politicians. So it looked at 35 mass shooters over the course of 37 years. And it said that 87.5% of those perpetrators of mass shootings did have a major psychiatric illness that was not treated properly at the time. So this is sort of what politicians are using in regards to saying it's a mental health issue. But the thing is...
rather than doing something about guns.
Right. Well... we can go down that rabbit hole, but which we probably will soon. But it kind of created a scapegoat, and really the contrast or the argument against that article is it was only 35 of the mass shootings. I mean, if you look at studies, there's 44,000 gun violence deaths a year. A year. And so you looked at 35 mass shootings and came to that conclusion. So it's not really an accurate depiction.
Right.
There's even other statistics, I should say, which show that if you, let's say, treated all mental health and, kind of, let's say, cured it, it would only decrease gun violence by 4%. And I'm sure people listening to this, there's going to be pros and cons, people that agree or disagree. But I do find that, and maybe T, you may agree, a lot of times we have patients that come in with homicidal ideation, threats to kill others, right? And we kind of evaluate intent, right? And it places a lot of sort of onus on us on whether someone else is going to create a violent act or, basically perpetuate a violent act. Sometimes we really kind of seek intent because a lot of people that aren't violent will say they want to lash out and hurt someone, but they don't have the intent, right? So that's kind
More
of
like a fantasy.
more of a fantasy.
Right. I wish I could do this. This is what I would do.
And
But they don't have intent or means. That is part of the risk analysis that we do. Somebody that says that they want to get a shotgun and shoot their neighbor because they're angry about something. If they have a shotgun at a home, you're more likely to see that increases the risk that something could happen. Even if they don't have intent, that still is, one of those risk factors we can't ignore.
And I think, you bring up a really good point with the gun, and that's like a big risk, right? And so, and that escalates things so intensely. Like, even if someone comes in and you don't
Even if you're just trying to scare them.
Yeah.
And you don't really mean to pull the trigger.
Like, the intent is
The fact
low.
that you've got it out, anything could go wrong.
At that point, you've escalated.
They go to reach for it and you freak out and now somebody's shot.
I've had numerous...
It could be you.
Yeah, you could accidentally
Yes.
shoot someone or yourself. And that's actually something that happens, I notice a lot, I would say, over the past few years, is consults of individuals who, didn't even say necessarily they wanted to hurt themselves, but they passively say it in some way, like they send some vague message, and then because they have access to a gun in their car, it's like police are bringing them in, they're mad at me. It's like, well, you kind of did this to yourself,
Yeah.
so...
Words that come out of your mouth, we're going to take them seriously.
Exactly. I mean, because it's better that than you harming yourself.
Yes.
And that's what, the studies really show is, like, the lethality of guns is so obviously permanent. Like, if someone overdoses on pills, let's say, there's a good chance they could survive. And then suicide attempts are an impulsive act. Everyone, after the fact, at some point, will regret acting on that suicidal impulse, right? So it's a matter of, surviving it. And if you shoot yourself, there's no coming back from that. That's it. And really, access to a gun is the biggest risk factor. Like 24,000 people a year complete suicide with the gun. I mean, it's not something that is to be taken lightly.
Right.
So.
And also these assessments that we do in the emergency room, we really have made great strides to incorporate data into how we determine suicide risk. And, we do this Columbia suicide rating scale that kind of helps us understand the intent, but also, have they had those thoughts in the last 3 months? Have they ever done anything to hurt themselves? Do they have access to a weapon? So we ask some of those questions to kind of streamline who do we need to spend a little bit more time on really nailing down what those risk factors are, because some people will say no to all those things and then we can, move ahead. But also the studies show that when people come to the emergency room with suicidal thoughts, they're 34% more likely or 34 times more likely to commit suicide within that year. So it's important to gather that information. We really encourage people when they go to their medical doctors, if they're having thoughts, tell a medical provider, go to the emergency room, but also tell your family doctor that you're struggling, tell your nurse practitioner, tell your PA, tell your dentist, tell somebody if you have those thoughts. Because there's help out there.
And when it comes to harming others, let's say, it is hard to sort of look at stratifiers or things that could be factors, right, that could lead to someone harming them, other individuals. There was an FBI data report where they looked at basically mass shooters and kind of some of their background and kind of history, and really it showed that really only 5% of them had ever been involuntarily committed to a mental health hospital prior to acting out on the shooting. So I mean, it's not very high, I mean, we'll call it a red flag per se. And obviously we have a perspective and an opinion on this, right? It's just kind of our opinion, but I think the reason that this is important, the more we sort of associate a direct causation of like mental health with gun violence, then you're just further stigmatizing mental health patients.
Right.
And
You're
I
not
mean,
really trying to get to the factors that
no,
lead to
all the societal factors, all the other factors that are playing a role. It's like they're all null and void. It's like you just say mental health and then that's the issue. And I think that's also interesting because it does come down, not to make this political, but political parties play a role. I mean, when you have, like, I'll just say it, Donald Trump is known for, a famous quote of saying, mental illness and hatred pulls the trigger, not the gun.
Donald frickin' Trump.
The man, the myth, the legend, okay?
Is going to get so many people killed in this country.
Directly
has had.
Directly or indirectly, honestly. But, yeah. And then his buddy, Governor Greg Abbott from Texas, said, anyone who shoots someone else has a mental health challenge, period. So, I mean, again, it's just kind of scapegoating.
What about self-defense? What about you're in my yard and I've asked you to leave and I've called the police and you still approach me? There are lots of things that happen that are not mental health related, but if you don't have the gun just right there in the heat of things, it's less likely to be a fatality.
Yeah.
And I'm not anti-gun. I mean,
no.
I would like to learn how to shoot a gun. Like, I definitely have never held a gun or, I have a child, so I've just sort of not wanted to have a gun in the house. But I'll go to the shooting range and try to, probably need to go on and do that now.
I went once or twice. And,
get ready.
I remember when I went to the driving range, that's kind of what was in the back of my mind. And I told my friends that I was like, literally, I could just take this gun that I'm pointing forward, point it to the side, and blow everyone away in here. Like, literally. It's just like, there's just too much, I don't know. It's like an unnecessary force, in my opinion. But, I mean, obviously, I'm maybe more of a pacifist than I want to admit. I don't know. It just seems like it's like a little bit excessive. But
I mean, I'm all for liberty. Like, people should have and there is the constitutional right that people can bear arms.
Yeah.
But I just, the access, it's just too easy to...
Well, and that's actually what Dr. Cornell from University of Virginia brings up, is it's like mental health, it's hard for us to sort of avert or prevent mass shootings because, we don't really have the ability, let's say, to manage gun control from individuals that have mental health diagnoses. Insurance companies don't really kind of limit even what we treat. So it's like, it's an opinion of mine.
It's going to take a comprehensive
approach.
Look at how guns and mental health, if there's some correlation.
Yeah.
How we see those things, differently, and how to separate that out. So we can do a better job of screening who gets a gun and who doesn't.
And whether that's wanted or not. Because otherwise, then it's just kind of open and really anything could happen. And, that's something else, too, like with mass shootings or with mass events. It's sort of like, it can be, let's say there is a mental health component. But there's also like an emotional stressor that caused this person to act out, whether or not there's an underlying mental illness. So, I mean, that's really also something else that we need to look at and address, is like what sort of caused that person to sort of get to that point and reach that gravity, because it is pretty premeditated, right? To go obtain ammo, a weapon.
At least from some of these stories that we've heard, in the news, who knows what the actual number is of, people getting hurt out there, but does seem like there's this whole manifesto that people are putting together that sort of explains the grievance and why they have to do what they do. And then there's like a trail, online of how they found the gun, bought the gun, got the ammunition, got the supplies. There's trails, there's things. And so chances are somebody who knows somebody who is planning some kind of thing or in distress right now and trying to figure out what they're going to do about it. And so
there's actually like a forensic psychologist that's part of the FBI, J. Reed Malloy, and he actually said that. He said 4 out of 5 perpetrators show signs of crisis that is often overwhelming their coping mechanisms prior to acting out, and that's exactly what you're saying.
Yes. So be on the look. If your friends are acting squirrely, or they're just online a whole lot more than usual, or they seem more snappy or irritable, or they start putting bumper stickers on their car that you don't recognize. Look for signs like, something is up with this person. What are they talking about these days? Are they fired up on their whatever channel they watch on TV, however they get their news?
I do want to say and piggyback off that, why a lot of times these individuals feel wronged, right? Mm-hmm. They feel wronged by society or something, and they want to place blame on a group. So why, as a society, why have we reached that point where these individuals are getting to a point where they feel so wrong? Where is that coming from?
Yeah.
I don't know. I know that's so hard to answer, but what are we doing? Is that a parental issue? Is that a school issue,
it's
a teaching issue?
Yeah, because we just grow up in all these different silos,
I know.
We grow up at home with our own little cultural biases. We go to school where we're exposed to other people's cultural changes. We're at the bus stop and we're talking to people, so we grow up in these things. And then as we work, we're now around a whole community of people that might think differently than we do or might influence to think in a certain way. So we are influenced by things, and if we are having a hard time in life, sometimes we don't want to look at inside. We want to look at what's out here that's making my life worse.
Yeah.
And I'll feel better if I just take care of this problem with these people or this issue,
which also makes
rather than look inside to see, well, what could you be doing to feel better?
And
that has nothing to do with these people. Please do not take me out with you.
No.
I'm going to the grocery store to get my milk, get my cookies.
Let me be.
I'm going, don't take me out with you.
Well, 30% of individuals do shoot themselves at the end of the mass shooting, which is interesting. And then I think another 10% are shot by the police. So almost half
kind of know going in
that they're not going to, there's going to be very low chance of survival. So, that's such desperation. And then also, I'm glad in the media that there's less notoriety being given to these individuals if we don't mention their names anymore, because I think there was a little bit of that after this happens I'll have some level of infamy. So I'm glad that that's been kind of tailored a little bit. And also just the character structure, really it's such an antisocial behavior to have no regard for someone else's life.
No empathy, right?
No empathy. And that's what what they looked at. Remember, obviously the most famous shooting's Columbine, right? So in 1999, they looked at the character structure of the shooters, and one was found to just be really a sociopath. They said he lacked empathy, had grandiose ideas, and so that kind of comes down to also how do you treat that? Because if you guys have ever watched The Sopranos, Tony Soprano is in therapy, and what did the therapist say? It's you can't really treat sociopathy even in therapy, so what do you do?
It is just anti what therapy is all about, which is self-discovery and looking inside and having empathy. They don't have any of that, so how could they
how do you formulate
truly
that?
Benefit from therapy? I guess it depends on the type of therapy, because there's so many different types of therapy out there.
There are, and I'm
just cognitive behavioral therapy. I don't think that
was
going to
do
it.
Yeah.
Sociopath.
Well, it also depends on their upbringing and several factors, because there are people that have high levels of sociopathy that are doing well and have jobs and don't engage in these kind of behaviors. So there's so many factors. Yeah. And I do think it's even the shooting that happened in Michigan, right, where the parents were incarcerated for 15 years. So in some sense, it's society's turning a little. It's we do need to have some ownership, also placed on their circumstances.
The people that they're around, yeah.
But it's such a, I don't know, I just thought it was kind of an interesting hot topic, because it's something that, there's no really easy answer for, but they kind of always, scapegoat us with mental health, and so I figured we just talk about it a little. It's kind of show, though, that there is some association. There was one study that looked at psychosis and schizophrenia. So there is increase. It was a meta-analysis, I think from the 1970s to 2009. And it did show that there was some increased violence and aggression actually compared to the general population.
Okay.
So that's kind of one thing that I did find, and maybe, I don't know, just to kind of...
Was it just any type of psychosis?
Yeah, it just said psychosis. And so
it could be substance-induced too.
Could be a few things. And I actually saw that substance abuse was a higher risk factor for these kind of gun violence events than even mental health.
Because they're disinhibited, so they're more likely to do something they wouldn't ordinarily do.
Yeah. Because you think too, this is just a personal opinion, but individuals that we treat with schizophrenia, if you're high level schizophrenic, you're so disorganized. Like
You're not really,
you're not
right.
premeditated to do that stuff. Like
In fact, that's one of the things, is that there's this misconception that people with schizophrenia are violent, and they're actually non-violent, because just like you said, they're just usually apathetic. Apathy can be a symptom of schizophrenia. So they could just be sitting and staring at something and not really engaged in anything, let alone masterminding some kind of mass casualty event. They're usually, if they are in violent situations, it's usually from a standpoint of defense. Like they become paranoid about somebody, they think somebody's coming in the house, so they get a gun or a weapon or a bat, and somebody just comes to the house. Like, like a door-to-door salesman just comes to the house. But they're convinced that this is the person that's been tried. So it's always like some kind of, they're protecting themselves rather than plotting something to go out and attack people. It's not usually that way.
Yeah, that tends to be more like sociopathy, like the antisocial stuff. And
conduct disorder.
And it's like, that's hard, because once you have that personality trait, I mean, and that could be a whole different maybe topic we do, maybe about just sociopathy and antisocial personality, but like it's something that's like, so there's no medication to stop someone from stealing, from engaging these behaviors. I mean, it's just tough.
Insight, trying to get them insight into how their behaviors are impacting people.
I'm not trying to negate, like we do need to play an impact and try and help family systems and help these individuals and get them to a point where you rehab someone before they would ever think to do this, right? Like let's say they do see a mental health provider and you get them into therapy and you can improve their quality of life. Because I remember there was one article I was seeing where someone was thinking of doing a mass shooting, and then someone came along and invited him to a movie and acted like a friend, and it said it kind of threw him off, right? And he didn't engage in that behavior. Whether he would have or not, no one can really say. But it's just interesting.
He didn't do it that day.
He didn't do it that day, right? And so people can have an impact. So I'm not trying to discredit that from our standpoint, but it is like more of I think society as a whole, we're schizophrenic in how we feel about guns and ownership and accountability. And it becomes like, oh, they had depression, so that's why this happened. And it's tough.
It's an easy answer.
It's an easy answer.
Difficult problem.
For a very complicated problem. So I don't know. Just thought we'd talk about it. Maybe raise some thoughts about it ourselves. I mean, okay, just from your own personal opinion on this. So you kind of answered this. You feel like people should have liberty and ability to own a gun if they want, right? Like, is that kind of a general?
I think we again have to look at what constitutes a citizen eligible to have a gun. Like, what are the factors that look into who is eligible? Because guns are there, and if we believe in our Second Amendment right, we should be able to, but there should be some kind of criteria for who should have a gun, and I think there is one, but that needs to be looked at again. And it needs to be tighter in terms of, have you had mental health treatment before? Maybe everybody who goes to get a gun has to have a mental health evaluation first.
I mean,
you could always, fudge it, but at least you've got some data. Yeah, like what happened beforehand. Why are you coming to get this gun? Like, there's no inquiry. It's just like batteries. You can just go get some and nobody asks you about it. But this is something that can impact life and death. We should have a little bit more conversation before we give somebody that weapon, to make sure that we're putting it in the right hands. That's what I'm saying. Like, I'm not saying you can't have it, but is it best for you to have it? Is it best for society? Then who's going to be the judge of that?
And that's ultimately, and no one wants really that kind of control placed on themselves. But,
I don't mind having some control. As a mental health professional, we should have some say. I don't know. And then maybe after a certain period of time, you can earn it. Like, I'm not saying that once you say yes on this question, then you can never have a gun. But there has to be some kind of like, you have to get a license to be able to drive a motor vehicle. That's also potentially a weapon. You have to have some questions answered before you could just get a license and drive a car. But then other people just jump in a car and go and take their chances that they won't get caught. So I'm rambling now.
No, it's okay. I mean,
but yeah, it's a complicated question. I just think that there should be more questions
I mean, I feel
answered
like
on
at
the
some
front
point
end.
too, in the United States, like the cat's out of the bag. I mean, there's so many guns that have already been sold. It's like, what do you even do at this point? You know?
Right. Nobody's going in to take people.
And everyone like that I know that owns guns always asks, and it's like, well, I want the ability to defend myself. And I just kind of feel like this is a personal perspective, but if it's like you reach a point where you're barricading your house with a gun to protect yourself from some unknown militia, it's over anyways. Let's keep it real. Like, it is. You know what I'm saying? Like, and then the other
The
thing,
Last of Us.
literally, at that point, if you have the resources, you're gonna go somewhere else because that's, you know what I mean. And then
Straight off to the compound.
right, and then that's another thing too is like, I'm not saying this is off topic, but like, let's say someone is invading your house, and you defend yourself and you shoot someone. Whether or not it was the only way to get around that situation is one question, but the other question is then like, what kind of trauma is that going to leave on you?
Yeah.
Whether you think it will or not, you killing someone is going to have profound impact on the rest of your life. So
Correct.
I mean, if you really want to take that, I mean, I guess
I mean, the alternative is that you're dead.
that from them,
Depending on why
what
they're
the
breaking into
situation
your house,
is.
yeah.
Yeah. I mean, is that also a fantasy? You're both holding up a gun, be like, who's gonna die first? Like, when does that ever happen? I've never heard that ever. And how many people do we interview every day?
Right,
So,
right.
I don't know. I mean, it's a tough thing.
Yeah.
So, little tidbit, little hot topic that we said we would have.
Hot topic.
So, let us know whether you like this or not.
Yeah, definitely share your opinions in the comments. Is there even a comment section?
Yeah, there's comments. There's comments actually on the podcast and Instagram.
Yeah,
so.
share it. Whatever
Yeah.
you think. I think it's important to have dialogue. I think nothing really gets changed until people start talking to each other.
Exactly. Okay.
All right.
All right,
The more
T.
you know.
Exactly.
Talk to you
All right.
next time.
Bye.
Bye.